The time is just gone 18 minutes past 9 a.m. We continue with news and views this morning. And a story that has broken out of Zimbabwe is about a young boy who was mauled by a hyena. And this morning, we are talking with Dr. Ridwan Mia, a renowned plastic and reconstructive surgeon, and also nursing sister Maqshuda Kajee, about South Africa, about South African healthcare workers who are now rallying behind this Zimbabwean boy who was mauled by the hyena. And we have got, right now, we are waiting for Dr. Ridwan Mia to join us, but we have got Sister Maqshuda Kajee, nursing sister, already online with us. Sister Maqshuda, Assalamu alaikum wa rahmatullahi wa barakatuh. Jummah Mubarak. Welcome.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Jummah Mubarak. Inayat, thank you for having us on your show.
Well, wonderful having you with us as well. And I know we are waiting for Dr. Ridwan Mia to join us. But while we are waiting for him, obviously this is a horrific story about a young boy, a young Zimbabwean boy who was mauled by a hyena. What do we know about this? What has happened? Please, some background, please, Maqshuda.
So Rodwell was in the company of his granny, and they were at an all-night church gathering outside Harare. They stay about 325 kilometers in a rural area, and him and kids were sleeping. I'm not definite as to where exactly they were sleeping, but in the middle of the night, this child was attacked and mauled, horrifically mauled by a hyena.
Yes, now we know this young boy was only 9 years old, and clearly this tragic event has actually touched the hearts of many people, including people in South Africa, people like yourselves as well, Maqshuda.
Yes, that's correct. It's definitely a story to tell, but I would like to stress that I don't want the story to get lost. It can't be a good story to tell with no effect, and hence I'm advocating on behalf of Rodwell and his mum that he desperately needs the funds to help him with his reconstruction of his face.
Yes.
Any child should be afforded that.
Exactly. And obviously, you've started this campaign in terms of raising funds. And the key issue here is for this child to come out to South Africa and to be treated, medical treatment. I see Dr. Ridwan Mia has joined us as well. Dr. Ridwan, Assalamu alaikum wa rahmatullahi wa barakatuh. Jummah Mubarak and welcome.
Alaikum salam wa rahmatullah. Thanks for having me on.
Yes, now obviously Maqshuda has just painted a brief background as to what had actually happened to this little young boy, this 9-year-old boy, Dr. Mia. And we have been talking about, raising funds. And the key issue here is to get this child to South Africa for a reconstructive surgery.
Yes, inshallah, that's the priority at the moment, is to get him here so we can actually start with his surgery. And inshallah reconstruct all the defects that have been caused by this terrible injury, devastating injury to his face.
Yes. Have we got any information with regard to the extent and the nature of injuries at this point in time?
Yes. So far we've had copies of his scans come through, and we've had obviously photographs. Just looking at how the wounds have what the original wounds were and how they've changed over time since he's been stabilized, and the wounds have been dressed and so on. So far it looks like they are doing a reasonable job of having kept them clean, not allowing any infections to spread over the areas that are exposed. So that's been helpful. What we have found is that part of the forehead, pretty much the entire nose, most of the upper lip, a little bit of the lower lip, the cheek areas, and his entire left eye were all lost in the incident. So those are all the areas that will need reconstruction.
Yes. Now, I just want to bring Maqshuda into the discussion as well. Now, Maqshuda, obviously, at the forefront of raising funds for for his medical, for this child to basically come to South Africa, and at the same time to be treated at the Centre Mediclinic, from what I hear.
Yes, that's correct. The surgery will take place at the Santon Medivac. The plan is for us to go and collect Rodwell tomorrow, inshallah, on a flight to Harare, accompanied by Dr. Sayuran Munsami, who is a flight doctor, and to bring him back for his treatment, of which surgery is provisionally booked for, an assessment surgery is provisionally booked for Monday, the 21st of June.
Now, obviously, there are certain challenges as well. Bringing him to South Africa from a logistical perspective, and just to make sure that all of that is in order as well, Maqshuda.
Yes, we're actually very fortunate that the process is so easy, because Dr. Munsami is actually a flight doctor with International SOS, and I am a freelance sister, so we know the system, a freelance flight sister. So yeah, it would have been a real logistical nightmare if we had to actually bring him on a proper medical medivac with a plane that was geared just for that. But South African Airlink have been very kind and have accepted him as a passenger, which makes it really easy for us. It cuts down cost. Rodwell is also stable, and therefore it just makes the process easier. His mum will be escorting him on the flight back here and be in a supportive role in his admitted.
Yes, and Dr. Ridwan, just looking at some of the challenges, and obviously you've got some idea as to what the nature of the injuries are, how severe, the injuries are, and we know that any procedure, no matter how big, no matter how small, obviously carries certain risks and challenges. Have you looked at some of those? Because from what you've just described, these are quite serious injuries. The young child has suffered.
Yes, I'm so sorry. I couldn't actually hear anything Maqshuda was saying, but yeah, just the surgery that he's going to have, it's going to be split up into a few procedures as a result. We obviously want to try and minimize the possibility of complications, and also mitigate against potential side effects that could happen as a result of the surgery. It is big surgery. I think one of the biggest challenges will be the nose, and the other one will be the upper lip that need to be created, reconstructed. And the left eye, we have a maxillofacial surgeon on board on the team, Dr. Jamil Desai, a well-known maxillofacial surgeon in Johannesburg and Newcastle, incidentally, who will be on board. And he's going to also, create a socket for the left eye, so that they can then do a prosthetic eye that will mimic the eye on the right side. So there's been a company that's volunteered to make the eye free of charge, and also to donate the implants that will be inserted into the cheek to create that socket around the orbit, so that the eye can fit into that. And in addition to that, we're going to reconstruct his nose. The surgical plan at this stage involves using part of the forehead that hasn't been injured, as well as harvesting cartilage from his rib cage, to be able to construct the actual skeleton of the nose, and then to use either his forearm or his thigh, to get what we call a free flap, which would be a composite of tissue. So it would be skin, the fat underneath, and a bit of muscle in perhaps as well. To reconstruct his upper lip, because his entire upper lip is gone, the full thickness of it is gone, so the gums and the teeth are actually exposed. So what we're looking at is a fold of tissue that can recreate that sort of impression of the lip, but also more importantly give him what we call a sulcus, so that little sort of passageway in front of the teeth, where he'll be able to eat, and not have a piece of tissue stuck to the gums, but still have a bit of an extra fold of skin, and that'll have to come from elsewhere on the body, which will be connected to blood vessels in the head or the neck area, so that it can remain alive. And then a number of smaller procedures on the cheeks and the lower lip, and the eyelids and so on, to get them to be more functional and look more acceptable, I guess, for a child, but also give him some sort of semblance of a reconstructed face, with minimal scarring.
Well,
So
certainly, it also appears, Dr. Ridwan, that in a short space of time, a lot has actually been done in terms of preparing, in terms of planning, and coordinating the entire operation.
Yes, I mean, I have to say hats off to Maqshuda. She's been tireless. She's been working so hard at getting the team together. And I must say we've had to scramble a little bit in getting potential funders on board, getting people to donate, and we had to use the relationships we have in the healthcare sector, and many of our colleagues. We had to reach out to them, and I must say, alhamdulillah, they've all been very forthcoming. We haven't had a single person say no, we can't, or we're busy, or we don't have time or anything. Everyone just volunteered their skills, their time, and said, well, we'll come to the party and we can really do whatever we can. And I must say, Maqshuda has been working really hard to get that team together and keep us all sort of in line and focused on treating this child, and then not having to worry about things like we had for example, a meal SA. We had the Smile Foundation, and a number of other organizations come to the fore and say, how can we help, and have done so much to already help. People like Dr. Ismail Mita, Mr. Shiraz Ghani, a number of individuals have just come to the party and said, how can we be of assistance? The World Mammon Organization as well, they've all come forward and said, well, we'll donate something. So yeah, I mean, we've just had not only the medical side, but we've had the community and society come through and say, what can we do to help? The need is there. People realize that we can't treat this child in the state sector. We can't do it at government or taxpayer expense, because there are South Africans in need. We have to be pragmatic and realistic about the country we live in. We're not a first world country with lots of excess funds that we can just bring a child from elsewhere and help him. So we had to rely on private funding, so that we don't deprive any South African children or South African patients of the healthcare sector here that is supposed to help them. So that was part of the challenge. And we've recently had a sponsor from Zimbabwe come on board as well to say, well, how can I assist in the process?
Well, it certainly sounds very, very encouraging, considering so many people have already come forward. But Maqshuda, obviously, the appeal is still there for funds.
Yes, it is. Rodwell's treatment is also just not one fold, it's a process of reconstruction over time. We also have to manage his mum and support his mum while she's here, amongst a few of the other challenges that we face. So yeah, it's not that we're telling the public that we have enough. Please open your hearts and donate. The money will be well spent and accountable for. Yes, we need to help him smile again. A simple thing like he hasn't eaten since the date of injury, which was 7th of May. Let's afford this child, a chance to smile again and just the opportunity to eat. It's as simple as that.
Yes, and just for people wanting to donate, who do they get it in touch with, Maqshuda?
A Meal SA, and there are banking details which I have forwarded to the Salam Media crew. It's actually a Meal SA and FNB account 6284 989 7197, reference face. Every cent, every rand that's afforded to this child will go a really long way. And as Team Rodwell, thank you for having us, and to the public at large for listening to us and coming forward and assisting us in every way that you can.
Well, Jazakallah for that, Maqshuda, and obviously we will put up the details on our social media pages as well as the Salam Media website, and we will share this with our BC lists as well in terms of our listeners, and we hope and trust that, inshallah, that everything that you are hoping for, everything that you've set out in terms of your objectives, inshallah, will be met. Just final thoughts, Dr. Ridwan?
We're very grateful to the community and everybody that has shown support, and we ask everyone who hasn't donated as yet, please donate something. It will go to helping this child. Know that all the medical expenses, like from in terms of the colleagues who are going to work on the child, they've all offered their time pro bono and are doing these operations free of charge. But it's the medication that we have to pay for, the time in the hospital, which is heavily discounted. The Mediclinic group has discounted that. So what you are paying for is the actual care that the child is receiving, the some of the equipment that's being used, the medicine that's going to be used, and obviously his transport and logistics, keeping his mom here, and the therapy he's going to need afterwards. So it's not going to go to waste, and it's certainly a worthwhile cause. It's really going to change someone's life for the better, inshallah, and transform a terrible tragedy, a terrible injury that he sustained into something where he could have a normal life. And I'm sure that there's endless reward for that. There's lots of reward for helping out this child. So please come on board, and jazakallah to all those who have offered their support. And again, to Maqshuda and everyone else on the team, personally very, very grateful, and may Allah reward you all. I think inshallah that this child will have a much better life because of all of their hard work.
Well, Jazakallah for that, Dr. Ridwan, and also to Maqshuda, Allah accept, Allah reward your efforts as well in putting all of this together, inshallah. And more importantly, we make dua for the success of young Rodwell's recovery as well. And inshallah, all will go well so that we can put a smile to his face eventually, inshallah. But as I said, the appeal will go out from us here at Salam Media. And inshallah, we trust and hope that our listeners and our viewers this morning will respond. But for now, Jazakallah to you for your time. All the best to you, inshallah. Assalamu alaikum.
Alaikum salam.
Maqshuda Kajee and Dr. Ridwan Mia with us this morning, and this horrific case of young Rodwell, 9-year-old boy in Zimbabwe, being mauled by a hyena. And he will be arriving tomorrow in South Africa to begin this treatment for his reconstructive surgery and associated medical treatment for him. And the appeal is gone out for the funds to be raised for the treatment of this young 9-year-old boy. Allah make it easy for all of us, inshallah. The time is just gone 9:36. We come back, we'll be joined by Hafiz Ibrahim Musa.